the problem of drink driving, we're told, is now being dwarfed by the problem of drug driving. But I understand it's much more difficult to deal with. Well, joining me is Ean Lewin, Managing Director of police drug test supplier D.tec International. Now, Ian, I understand that you produce this kit. The breathalyzer we understand fully. You blow into it, and then if you failed, it's back to the police station for a blood test. If that's confirmed, you're going to get banned. You're going to get fined. And actually, these days, a fair degree of social opprobrium that comes with drink driving. It's not considered to be a laugh anymore. Your kit tests for drugs at the roadside. Can it test for all kinds of illegal drug?
Good evening. The key drugs that it can test for is cannabis and cocaine. And you'll find in the UK, that's probably 85–90% of the drugs that are seen.
So let's say, the driver is beside the road. He or she fails the test. They then have to go through the same procedure, do they not, of going back to the police station and having a blood test. But I understand that's where things start to get rather difficult.
Yes, you're correct there. The same with alcohol. There is a legislation, Section 5, that says if you're above a limit, then that's the offence for which you will most likely get a 12-month minimum ban.
Yeah.
The same is in place for the last 8 years for drugs, where if you fail the test at the roadside, then you're arrested, taken back to the station. But in this situation, we need a blood sample. And that blood sample takes some time to get yourself to the station where you can extract the blood. We need a healthcare professional. We then need to send the blood off to the laboratory, and this is where the problems occur.
And is that because it takes longer to get those blood tests back than it would for testing for alcohol in blood?
Exactly. We're used to a situation with alcohol where you're arrested and taken to the station. You blow in the confirmation machine, and quite literally that is evidential there and then. You're in the court the next sitting that's available, so probably same week or next week. The drug situation is the bloods are off to the laboratory. The laboratories seem to take an inordinate amount of time, and that can be in the region of, as the report shows, 4 to 5 months, maybe in many cases longer than that. And with our other parts of our legislation, if you are not charged within 6 months of the offence, then it's dropped and you're off scot-free.
So in effect, if this is just too difficult for the police to do, does this become an issue, drug driving, that they effectively start turning a blind eye to?
Very, very, very different from that. The police on the road are there all the time. They're vigilant as to what's going on, seeing an impaired driver or there's an accident that they're attending, a collision. Yeah. And with that, they will assess alcohol. They will assess if drugs are part of the possible contributory cause. And that's when they bring the breathalyzer out or the drug wipe to do the screen.